My name is Foster King. I have a doctorate degree in physical therapy. I've been a practicing physical therapist for 8 years now. I graduated with a degree and moved to Colorado, where I was practicing for 3 years. And during that time, I had mixed results with a lot of my patients. So I was struggling to get some of the more complex patients treated. This is when I discovered the Institute of Physical Art and Functional Manual Therapy, which is taught by Greg and Vicki Johnson out of Steamboat Springs, Colorado. I started taking their courses, and by the third course I was totally sold on the material, as I was seeing tremendous gains in my patients. So I enrolled in a residency in functional manual therapy, which is a year-long focused intensive training in the material. So the good thing about functional manual therapy is that the techniques and the treatments can be applied to all parts of the body and service any number of diagnoses. So common things that we might see are herniated discs, spondylitic degeneration of the spine, neck, back, ribs, whatever region can become deteriorated, those areas can be diagnosed and treated. Arthritic conditions of ankles, knees, or hips, shoulders, things to that effect are very common that we see here in the clinic. Some of the more unique things that we work with are, well, let me rewind a little bit. Those types of diagnoses, the duration of treatment is kind of dependent upon how advanced the condition is. As a generality, we expect to find moderate to significant results within 5 visits at a most. And if we're not achieving some of the goals within that time frame, then we start to consider alternatives to physical therapy, whether that would be dry needling therapy, acupuncture. It could be going for a referral to an orthopedic specialist for a surgical consultation. What we try to do is we try to empower our patients so that they feel that they've received the best therapy that they can get, and then take that information to the surgeon and have a discussion with them where we hope to educate them on to the potential outcomes as well. And we work as a team rather than isolated members of the medical community. So the diagnosis and the treatment duration is dependent on the person. We treat a variety of ages, from children as young as 3 to 5 years old, all the way up into the latter stages of life into the 80s and 90s. I currently have an 87-year-old man with Parkinson's on my schedule who we're working to help restore some upright posture and strengthen his spine. We treat a variety of patients who have had strokes or neurological insults, spinal cord injuries, through our techniques, and we really seek to improve the efficient function of every person who walks through the door. So we certainly work hard to establish a good patient accord with our patients, and develop a plan of care that's unique to the person.